This is what we do. This is
this is an activity in Boca Raton.
we share. No, in Boca we do share good secrets. People here don't keep things to themselves.
Okay, I'm pulling into Dr. Handal's office here to meet Siggy for her procedure. I'm outside of Dr. Art Handal's office here in Boca Raton, Handal Plastic Surgery Center. It's a gorgeous place, and my buddy Siggy Flicker is in there. She's getting ready for a procedure. It's called Body Tight by InMode. It's a brand new piece of equipment that Dr. Handal has, and he's going to address her love handles.
Siggy's an old friend of mine as well as a patient.
I've been going to Dr. Handal for 25 years. I love this man.
Well, thank you very much. We love you.
So do I. Did my face last year. I love it.
Stomach.
Love it. Now, you're an enthusiast of cosmetic procedures.
I am. I always think that it's very good to maintenance is key. I'm 51 years old, and every time I see something, I come to him, and he'll turn me away if he doesn't think that I need it. But right after I had kids, I came to Dr. Handal, and I remember I always had a little bit of a muffin top, and he said, "Siggy, go work out and come see me in 7 months. You just had a baby." I came back. He saw that there are problem areas to every woman's body.
Oh, absolutely.
Where you could work out all day, all night, and still not lose certain areas. That's where this man comes in because he's an artist. He perfects those areas. So I've come to him for several things, and I'm back here because I'm so satisfied over and over again, and my husband trusts him. And look at this. I had a tummy tuck. Now I'm 51 years old. I never had a bad stomach, but what he did is he gave me a corset. It's no longer, there's no loose skin everywhere. So it's not about changing and coming out looking totally different. It's about taking what you have, and as we age, we can't do anything about the gravity. Things start to fall, things start to drop, and things start to get loose. That's where this man comes in. And now there's a latest machine, and it's made in my country, Israel. Shalom. And the Israelis are geniuses, and they do everything right. So I'm going to let Dr. Handal talk, because we all know I could talk too much.
Okay, thank you, Siggy. All right, Dr. Handal.
I don't have to say anything.
Well, you can tell us about the machine.
I really am not a believer in technology unless I know it works. And after all these years, I finally found some technology that really works, and I'm super impressed about it. What we're going to be doing to Siggy today is a problem area that she's always talked to me about, but back then we didn't have any real
to him and I say,
good
"Dr.
technology,
Handal?"
but now we do.
I work out. I'm not a lazy person.
Look at those muscles.
I'm at the gym, but right where the bra, I call it bra fat, back fat, whatever you want to call it. It's just been a problem that there's two pockets that never leave it. And when I'm wearing a tight shirt, you could see ripples.
If you want to turn around, this is the area that's bothering Siggy, and you can see here. You pinch them to assess how much fat is there. So by pinching here, you could see that in between my fingertips there is some fat, and there's a little bit of fat here, and then the love handle area. Now, just removing this fat will not be enough. So what we're going to be doing is using this radio frequency device. This little portion of it goes underneath the skin through a small needle-like incision. It's not. We don't even use a scalpel for it. It's just a needle stick. And then this part of the device emits radio frequency energy onto the skin. So it's kind of like a sandwiching device. It goes underneath, and it heats up the fibers and the skin internally as well as externally. So once you achieve these certain temperatures, you'll actually see the skin shrinking, and then we suction whatever fat has been liquefied there, and then we...
you suction it immediately while you're in there?
Oh, yes. And then we do another pass with the machine. So we do a very aggressive treatment of the area.
Oh, pretty exciting, isn't it, Siggy?
I'm so excited. And also, people should know that it also works well over here. I have not done this, but I have a lot of friends who have come to Dr. Handal who have that. You see how it jiggles a little bit? It's 51 years old. It's going to jiggle. This does not bother me. It can jiggle all at once. I don't really care about
Hit
this.
that area too next time.
I'm just saying. I've had 3 girlfriends come to Dr. Handal, and they're under their arms now is like this.
Correctly, this technology can get you fantastic results. I've done patients recently who a year ago I would have thought nothing of doing except a facelift, and they got pretty much 80% of what a facelift would give them.
We saw the pictures, didn't we, Siggy?
Mostly,
Unbelievable.
This is very exciting, Siggy, isn't it? Brand new machine.
Brand new machine.
You ready to go?
I'm very, very excited.
and we have the latest generation, which is the most powerful one, so you're going to get some good results today.
BeckyinBoca,
I'm ready if you're
Handal.
ready.
I'm excited. Let's do it.
Okay, beautiful.
Okay. Dr. Handal has entered the OR now. We have Siggy Flicker here on the table getting ready for a procedure. You want to quickly tell us what you're going to do here, doctor?
All right. Well, today we're going to get rid of these rolls on the back, or the bra fat that everybody is very unhappy about when they get these issues. And there wasn't much we could do about it before. We've already done a little bit of liposuction on it, but the skin is a little bit stretched. So we're going to improve the skin elasticity by doing 2 things. We're going to use the body type machine, which is a radio frequency device by InMode, which heats up the collagen fibers internally, and the external portion of the device heats up the skin to a certain temperature, which will promote skin contraction and improve skin elasticity. So this will tighten up her back as well as remove some excess fat. Now, we're doing this under local anesthesia, which is great about this procedure. We are here in our fully licensed ambulatory surgery center doing this procedure, but although we do a lot of general anesthesia surgeries, this is the type of surgery that we can do under local anesthesia. So we gave Siggy some oral medications, and she's feeling, a little groggy, a little loopy. And we have our new machine called Pronox, which is a nitrous oxide machine, which they can take a deep breath and inhale the anesthetic, which will blunt the sensations of the injections. And once we get the injections of local anesthetic in, then she doesn't need anything else. She's cruising. All righty.
Okay, we ready to go?
We're ready to rock and roll.
Pretty amazing.
So you can see now the local anesthetic is in. She's pretty comfortable. All right, I've already reached the right temperature in this area here. That's what the indicator is telling me. So we go faster in this area because we want the skin to heat up now. We already got the internal temperature where we want it. I want the skin tighter.
Okay, so you're doing the liposuction now?
Yeah, now we're doing the liposuction. We did the body tight.
Okay, you can see the fat going into the tube. He's doing the liposuction now. See the fat coming through the tube?
Nice. You're doing great there, Siggy. Hang on, hon.
Siggy, you look amazing. This is incredible.
When I'm done with this, I'm going to repeat the body tight procedure again to make sure I got that skin as tight as I can. Yep. Now you pinch the skin, you see this is the proper amount of fat you want in between your fingertips. You can't have all the fat removed. You have to have a little bit there. And I know she will definitely have an improvement. We'll see how far we can get it to shrink with this, and I'm sure she's going to be very pleased.
I can see the difference in Siggy already.
So I'm just going to do a little bit more cleanup, then I'm going to insert the body tight again to get the best results for her. And sometimes you can hear it sizzling underneath where it's tightening up the skin. See that indicator there is telling me what temperatures I'm reaching on the skin and what temperatures I'm reaching internally.
He's done with this side.
So you can see now this simulates her standing up, and you don't see that fold anymore.
Amazing.
So we're done with this side. And we're going to go over to the next and she'll be done.
Okay.
And, hopefully, she'll have excellent skin retraction. She's definitely going to get a huge improvement, but we'll see some immediate results. And then over the next 5 weeks, you'll see a great improvement. And then it takes up to 1 year before you see the final result.
So the crease that was there before is no longer there. Okay, Siggy's a lucky girl here.
Can I turn over? No,
All right, so they're gonna turn Siggy over and do the other side. Siggy, you're gonna love it. Okay, so I just left Siggy. She's still in the surgical suite. They did one side, and they're going to flip her over and do the other. It's Body Tight by InMode, and it is just amazing from what I've seen. Right before my eyes, I saw this whole area shrink up and get smaller. And Dr. Handal says it will even improve more and more over time. And this equipment can be used anywhere on the body. It can be used on the face. It can be used under the arms. It can be used on the knees. It's just incredible.
So, for 2 days, I'm very, very happy with these results. And I don't think we could have gotten this kind of result without this device. And that's why I told Siggy there is not much to do for her until recently. And that's why we decided to go ahead with this. And I'm very, very pleased. She's very, very pleased. And you can see very little bruising. We're only 2 days. She was very active, local anesthesia with a little oral sedation. And it's a fantastic procedure. So now she's going to have to wear a garment for some compression for about 3 weeks. And she could even change it to Spanx or something like that. But as long as she has some nice smooth compression on here, and she's just going to be getting better and better results over the next 6 to 12 months. But within the next 5 weeks, you'll see some really good changes. And you can see these only little needle sticks. We didn't make any incisions other than a small entry the size of a big needle just to get the device in. And what it does, it shrinks the skin externally as well as internally.
That was bothering me when I was wearing loose shirts. I had 1, 2, and 3 right here. So
Dr. Handal, those folds are gone. I just saw them.
Yeah.
So you want to tell, it was a combination of the lipo and the skin tightening, right?
Well, part of it is there's a little extra fat over there. But the other part of it is the skin tightening, because remember, when a woman goes through a pregnancy, it's not just the belly that expands and the breast, the whole body expands. So when you lose all that weight, the back fat, it seems like, first of all, it gets a little more stubborn as a patient, progresses with age. And then the other thing is that skin is stretched. So the best way to treat this is to take out some of the fat, but if you just take out the fat alone, the skin will sag. This radio frequency device will actually tighten up the skin externally, so the skin itself will tighten up, and then it tightens up the fibers on the inside. So that these fibers that go from your skin to the deeper tissues, and that's what holds your skin in place. So what this technology does, it actually shrinks these fibers and pulls the skin back down to the muscle and the deeper tissue.
And I saw that happening in the OR when I was in there.
It's
right
amazing.
Before my eyes.
You could actually see it happening before we even suck any fat out.
Mm-hmm. So I had this problem area, and I said, why do I have to live the next 20 years with this problem area? I like to look good in my clothes, I like to put on a shirt, and I don't want to see this.
And it's gone. Siggy's results are amazing.
I'm
so
very,
happy.
very pleased, yeah.
And I'm on my way to Israel in 2 weeks, so,
You'll be just in time.
it's going to be 110 degrees, and I'm not, I'm going to be wearing my dresses.
You'll be able to show those abs and your side.
No, I'm
your
going
back.
to be able to wear my dresses and not feel self-conscious about anything hanging out, and I'm very excited. I'm very, very excited.
I'm excited for you.
I'm going to be on that camel.
Send me a picture.
Trust me, they'll all be posted.
Okay, remember what she looked like before the procedure? Dr. Handal could actually pinch those folds on Siggy's back. And look at her now. The skin is all smoothed out, and he says it's going to improve even more over time. Are you excited?
Very, very excited.
Bye!
Okay, so Beck, you're going to meet me now?
Yeah, now where am I going?